Today I'm speaking with Dr. Nicole Solomos. She is a dual board certified sports medicine and lifestyle medicine physician. She's also a certified life, health, and wellness coach. So she works in a private orthopedic practice, but she also has a really successful coaching business focusing on lifestyle medicine for her clients. Dr. Solomos, thank you so much for chatting with me today.
Thank you so much for having me. It's an honor.
Well, I love what you're doing. So how could we not chat about this? I mean, I think you're doing amazing things for people who really need a sense of how to turn their life into a more positive direction. So I'd like to start from the beginning. You're board certified in sports med and lifestyle medicine. How are you using that then to transition into coaching clients?
Yeah, it all seems to mesh together because as you said, I work in sports medicine, and that's what I do in my practice. I'm in an orthopedic practice. I do sports medicine, but in that practice, because it's ortho, I see a lot of people with joint pain. So I became very interested in lifestyle medicine a few years ago, and did get my certification because I really felt that there was so much more that I could do for patients, even outside of my medical office setting for their joint pain. Sometimes people are just at their wits' end with pain, and it's difficult to actually treat or actually give them a solution in the office. More of, what I do in the office is treat the symptoms, but that's not always going to be the end game for them. So I just felt that many of my patients were frustrated, and that I was frustrated too. And lifestyle medicine really has been a great addition to my practice, as well as coaching, because now I have the tools to implement both sports medicine and lifestyle medicine to find their solution or to lessen their symptoms of joint pain.
Yeah, and I think it's really important that you said what you did about in the office setting. As doctors, usually we're seeing people who already have a problem, right? They don't come to us when they're totally healthy. They need us for something. But you're using your other talents and your certifications as a coach to help prevent that from happening in the first place. So you're advocating for this really healthy lifestyle to fix disease before it starts. And I love that because it's so crucial in our healthcare system today that we don't just focus on disease, but we really fix the stuff from the beginning. So let's talk about the lifestyle medicine, because that's a newer certification in the field of healthcare, right? This didn't exist, just a few years ago. So what kind of training and things did you go through to become certified in lifestyle medicine?
I certified in lifestyle medicine in November of 2020. So my training was before the pandemic began. And so I did it online. There were a bunch of modules and just a lot of learning. You had to get a certain amount of CME credit and then take your exam and become board certified and submit case studies. I mean, it was a rigorous process, but one that I just felt so passionate about. And I really felt like this was the way that I lived for the most part. I mean, I certainly learned a lot through that certification, but it was rigorous, but so worth it, and just such a great addition to what I already did.
And I think it really kind of goes hand in hand, because a lot of sports medicine, you're hands-on, you're treating the whole body. Maybe they have knee pain, but you're treating the whole spine below and above that joint, right? Because you're focusing on everything. With lifestyle medicine, it's not one approach only. You're still doing holistic care and treating the whole person. So I think it's really cool that you're blending those two and blending them really well together. So let's talk about the coaching on lifestyle change and focusing on improving health while decreasing symptoms, maybe of chronic disease. I know you were talking about quitting sugar and getting people off processed food to improve their health. But when someone signs up with you to be as successful as your previous clients have been, how do you get started with them and what can they expect?
So I think obviously everybody is different. So um, coming at it from the appreciative inquiry approach and all these tools that I've learned through coaching, and just open-ended questions, and really like finding out what is their story, what is their circumstance, and we go from there. Because oftentimes we tell ourselves something over and over again, and then it becomes a truth to us. So I feel like that ties in very well to what we're talking about here. I mean, it's going to be different for everyone, but I think we have to start where they are and find out what their issue, what that circumstance is, and what they think the problem is, and then slowly uncover what the actual problem is, which is usually the way they're thinking about it. So getting to their desired result is often a pretty arduous process, just because we uncover all types of things that have led to the result that they don't want. So I think it's different for each individual. Although I do think, in my coaching practice, I've done some group visits, which are really helpful too, because, although each individual is, different, there are often very many similarities, and people have this just camaraderie, like, oh my gosh, I'm not the only one that has that issue, that feels that way, that thinks that way. So, it's individualized, but as well, I think being in a community and hearing others can really like give somebody that reassurance that, hey, I'm not alone in this, and I can get better, and so can they, and you work as a group. So
yeah, it makes sense why you're successful with your multi-system approach, where you meet your clients where they are so that they have a comfort level, and then you carry it forward. So I love what you're doing. Thank you so much for making such an important and impactful difference to so many people, Dr. Solomos.
Thank you so much for having me.